Comfy Acupressure for the Elderly is an acupressure protocol developed by the School of Chinese Medicine at the University of Hong Kong in collaboration with the Yanchai Hospital Social Service Department. It was developed on the basis of traditional Chinese medicine. The treatment involves 12 steps that concentrate on acupoints found on the face, head, neck, and shoulders. The 15-minute treatment protocol is designed to be performed by informal caregivers after proper training. It can improve the quality of life for elderly people living at home and in residential institutions. The following is the demonstration of the full protocol. Step 1. Opening. Tianmen. Apply massage oil to the center of the forehead. Using the index finger or the index and middle fingers together, gently stroke the forehead in a straight line from the eyebrow to the hairline. Do this 15 times using both hands. Step 2. Pushing Qian Gong. Use massage oil. With the index and middle finger, or the middle finger alone, massage both eyebrows at the same time, starting from the center of the brow to the outside. Do this 15 times. Step 3. Pressing and kneading. Tae-Young. Using the middle fingers, press and knead the acupoint Tae-Young in synchronized action 15 times. The kneading action should be firm enough to move the subcutaneous layer of the skin. Step 4. Kneading face. Using the index, middle, and ring fingers, or middle fingers alone, massage the face in a circular motion according to the following sequence: forehead, temporal area, orbital area, zygomatic area, cheek, nasal area, and lower jaw. Repeat the circular kneading motion 3 times, focusing on the following acupoints: Yang Bai, Tae-Young, Quan Liao, Ying Xiang, Jia Chu, Di Chang, and Jinjing. Step 5. Grasping. Wu Jing. Place a thin towel on the head and put one hand on top of the towel. Put the middle finger on the dew meridian, the index and ring fingers on the bladder meridians, and the thumb and little finger on the gallbladder meridian. Move the 5 fingers in synchronized action to lift and press on the treatment area. The fingers should move both up and down and sideways on the meridians to cover the entire head. Do this for 3 minutes, 1 minute on the top of the head, 1 minute on both sides simultaneously, and 1 minute on the back of the skull. Step 6. Pressing and kneading. Feng Qi. Place a thin towel on the head, then using both thumbs, or the thumb and index or middle finger, press and knead the acupoint Feng Qi on both sides of the neck in a synchronized motion. Repeat 5 times. Step 7. Pressing and kneading the neck. Place a thin towel on the neck area. Using the thumb, index, and middle finger, lift and knead both sides of the neck. The motion should be rhythmic and synchronized. Do this for 3 minutes with 1 minute on the upper part of the neck, 1 minute on the middle, and 1 minute on the lower part of the neck. Step 8. Pressing and kneading. Jinjing. Place a thin towel on the shoulder. Using the thumbs and index or middle fingers of both hands, Lift and knead the scapula tendon at the shoulder area with gentle pressure. The action should be rhythmic and synchronized. Continue for 3 minutes. Step 9. Pressing and kneading. Tianzong. Using the thumbs or middle fingers of both hands, massage the acupoint Tianzong on both sides of the back in a synchronized motion. Repeat 5 times. Step 10. Pushing. Qiao-gong. The caregiver applies massage oil on the sternocleidomastoid muscle of the elder at the front of the neck area. Using the index and middle fingers, or middle finger alone, press along the sternocleidomastoid muscle in a light, swift action from the top down. This action should be repeated 50 times on each side. Step 11. Grasping. Jinjing. Using the thumbs and index or middle fingers, lift and grasp the scapular tendons of both shoulders with enough pressure to cause mild soreness but not pain. Do this 5 times. Step 12. Grasping. Hegu. Using the thumb and index or middle fingers, lift and grasp the acupoint Hegu on both hands using enough pressure to cause mild soreness but no pain. Do this 5 times. Steps 11 and 12 are the final steps of the protocol. Again, the force applied should allow the elder to feel enough pressure to cause mild soreness but not be hard enough to induce sharp pain. As supported by clinical experience and review literature, applying acupressure therapy on the head and shoulders significantly improves blood circulation. It can also reduce stress, brighten the senses, and have a calming effect. For the elderly, especially those who are frail or suffer from chronic diseases, comfy acupressure for the elderly is a non-pharmacological treatment to enhance our functional abilities and quality of life. After treatment, people are more relaxed, comfortable, and happier. The protocol is designed to be given by trained laymen. The acupoints chosen are all easy to locate, and the techniques involved are easy to learn and safe to use. We suggest progressive promotion of the acupressure protocol to residential care settings and the community at large.